I appreciate that, Madam Mayor. Thank you for your generous remarks, and thank you for recognizing all the esteemed leaders here in Alameda County. I just want to acknowledge Alameda County for their excellence. When we look county by county, all 58 counties here in the state of California, one county stands out in terms of their speed to administration, taking vaccines and getting people vaccinated, and that's Alameda County. So I want to just recognize their partnership, their stewardship, their commitment to the cause that unites us here today. The cause that unites us here today has been amplified by our new president, President Biden. We are pleased and privileged, as they announced earlier in their press conference nationally, to identify here California as one of their first pilot sites for over 100 community sites, large mass distribution vaccine centers all across the United States. California will be launching not just this site here in Oakland, but also a site down in Los Angeles at Cal State LA. The whole idea is to speed up the throughput, the efficiency, maintain an equitable lens in terms of the application and distribution of the vaccines. Equity is the call of this moment. The reason this site was chosen was the framework of making sure that communities that are often left behind are not left behind. They're prioritized in terms of the administration of these vaccines. As a consequence, we are blessed not only by the announcement of this partnership with the Biden administration, but their full federal support in terms of the allocation of the resources to help us move forward with the distribution of these vaccines. This is a partnership with FEMA and the Office of Emergency Services. We'll be working with the county and local officials, hiring local individuals from the community, creating opportunities, creating jobs for community members to distribute what we hope is a minimum of 6,000 doses a day, hoping to build from that moving forward. This, again, is one of many sites all up and down the state of California, but this will be the first site done in partnership with the Biden administration. None of the vaccines come from otherwise allocated vaccines that we will be receiving here in the state of California. This is additive. Again, this is part of a strategy all across the United States in the first 100 days of the administration to get 100 of these sites up and operational. We hope to have this site up and operational in the next number of weeks. The set goal, 16th of February, to get this site operational. If you're interested in accessing this site, we are launching in a few weeks as well statewide a new app called My Turn that we have piloted in Los Angeles and San Diego. The pilot's been operational for 2 weeks. It's been a success. The app will be made available as we believe, the most comprehensive end-to-end application of its type of any state in this country. Not only will allow you to be notified when it's your turn for a vaccine, but also allow you to schedule the vaccine and allow us end-to-end feedback from providers, providing data not only to the state, but to our federal partnership. It will provide transparency. It will provide us a higher level of accountability and ultimately allow us more efficient, effective, targeted throughput in terms of the administration of the vaccines. So you can go to My Turn today here in Alameda County, and you can get the notification benefits. The scheduling benefits will be online in a few weeks. But nonetheless, it is a site that's available for registration and ultimately for scheduling outside of LA and San Diego when the pilot, while we move away from the pilot to a full-scale statewide operation. I want to talk about this state. Everything that should be up in relationship to this virus is up. Everything that should be down is down. Let me be specific. A month ago, on the 4th of January, we had an historically high number of cases reported in the state of California, over 60,000 cases. Today, we report 10,501 cases. 60,000 less than a month ago, 10,000 cases reported today. Our positivity rate peaked, the 7-day positivity rate peaked on January 7th at 14.3%. It's now down to 6.1%, more than half a reduction in the positivity rate in less than a month in this state. Today's reported number, when you look at a 2-week trend line for ICUs and hospitalizations are down 29.5%, 30% decline in a 2-week period in hospitalizations, and a 21.5%, 22% rounded up decline in ICUs in this state. This does not mean we're out of the woods. Many are talking about this new variant, this new mutation. Many are talking about the UK variant, South African variant, and also this West Coast variant. We have done just shy of 12,000 sequences of genomics in the state of California. State leads this country in genomics sequencing. We have had a bird's eye view from day one in terms of some of these variants and mutations. Today we have 150 reported UK variants here in the state of California, 960 West Coast variants, and there are 2 versions, 2 mutations in this state, 1429, 1427. That's neither here nor there, except to say we're monitoring that variant, monitoring the UK variant, and we currently have no South African variants to report, but clearly we're monitoring that as well. The virulence, the transmissibility of those variants are obviously of concern, and that's why we have to be cautious. That's why we have to continue to be mindful. That's why we have to continue to do the things that we all know we need to do in terms of physical distancing and wearing our masks and maintaining hygiene and doing the good work that we've done to be more vigilant at this moment, perhaps than any other moment, because we see the light at the end of the tunnel. With these vaccines, with these case rates declining, we see light at the end of the tunnel. In order to get our businesses open, in order to get our schools open, which we are committed to getting our schools open for in-person instruction, to do that more efficiently, more expeditiously, we need to continue the good work we have done in this state to continue to see that case rate decline, these ICU and hospitalizations decline, and that positivity rate. 6.1%, still not where we want to be. We have tripled the number of daily vaccines that we have administered in this state just in the last few weeks. While that's good, it's not good enough. We were in the 40s, high 40s, in terms of our national ranking. We were in the high 30s. We're now in the high 20s. We're moving in the right direction. We're above the national average. We don't want to be average. We want to do more and better. We maintain a new focus. We have a new framework. We are being more aggressive. We're enforcing rules and regulations. We're reallocating vaccines that are not being administered. I'll give you an example of that. 170,000 were reallocated yesterday. CVS had that hadn't been administered. And we sent them over with an equity lens to have Kaiser administer half of them specifically to low-income communities. We are being more aggressive in that respect. And as many of you know, we announced a new partnership with Blue Shield and Kaiser as third-party administrators. On February 15th, we will have that contract made public. Details of that will be put out. 2 nonprofits, no profit in this process, all about logistics, warehousing, all about making sure the equity frame is advanced and there's provider accountability across the spectrum. So we're enthusiastic about that to build on this momentum, but we're not slowing down. We are moving much more efficiently and quickly. Good news in closing, before I introduce Senator Skinner, is the federal government's doing the same. Now, we recognize what you recognize. There are parts of the state that are already running out of vaccines, where they're throttling back in terms of their dose allocation because they're running out. Federal government doesn't have the doses to support states like ours at the scale we all would like to see. We are limited on the basis of supply. This week, we will receive 1,060,000 doses of the vaccine. That's encouraging. We are averaging over 1 million vaccines being administered at this moment a week, and so we certainly can keep up with that rate. This is a flywheel. We'll only increase that pace and distribution. But it's an encouraging sign, and we, of course, will be looking, as every other state, every other governor in this nation, Looking forward to the single-dose vaccine, not just Moderna and Pfizer and the two-dose regimens, but the Johnson & Johnson that can't come soon enough that will ultimately help really fast-track the throughput. Also, in closing, forgive me for lingering beyond perhaps my allotted time, we also were pleased to hear, as many of you did yesterday, that on February 11th, the Biden administration, in partnership with pharmacies all across the nation, will be allowing direct allocations to pharmacies for traditional administration of vaccines. I say traditional because many of you get vaccinated at pharmacies. You get your flu shot at pharmacies. We'd like to see, with ample supply, an abundance of supply, your ability to do the same in pharmacies all across this state. That first commitment was announced yesterday by the Biden administration. It's additive and it's encouraging. So new partnerships that are meaningful, partnerships that are targeted, partnerships that are focused on equity, focused on throughput, efficiency, partnerships that build on the existing infrastructure, partnerships that magnify our resolve and commitment to do more and do better. No one is satisfied with the pace of distribution of these vaccines. Of course, we have more work to do, but we have made demonstrable progress, and we will continue to build on that over the course of the next days, weeks, and months until we eradicate and eliminate this disease and move forward, as we will, more resilient, more capable as a state and a nation. And that's a day we all look forward to. And today we're marking and planting a flag of a different mindset, a different framework, a different partnership with the federal government. And for that, we are grateful to the Biden-Harris administration. With that, let me introduce your senator, Senator Nancy Skinner.
Thank you, Governor Newsom. Thank you, aides. Thank you, federal administration. Thank you, Mayor Schaaf, and all of the other partners that are here. Governor Newsom just gave some great data on the drop in cases in California, the improvement that has been made. You know, everyone knows the just horrific surge of COVID and the number of deaths that California was experiencing and the incredible pressure on our hospitals due to the high number of COVID cases. But what I want to be very clear about is that it is Governor Newsom that we can thank for that drop. Yes, the public followed the orders, but if that public health order of the reinstating of the stay-at-home had not gone into effect, and their medical professionals just released a report documenting this, that if that had not gone into effect, we would not have made the improvements that we made. And while all of us are frustrated, we want to be able to, sit outside and get a meal or do the other things. We're tired of this pandemic. We're tired of this virus. We are doing the right things in California under Governor Newsom's leadership, and we have brought that surge down, and now it's upon all of us to make sure that we keep that surge down and that we go about our engagement in the new activities that are opened up again, but we do them as carefully as possible, and we wear our masks, and we keep our distance so that we keep those COVID rates down. But I really just want to thank Governor Newsom for that. And now, what a relief that we have a new administration and that we now have some order to this vaccination rollout. Under President Biden, look, anybody watching the news, every single state is frustrated. When are we going to get our vaccines? When can we have consistency of supply so we can plan? And that was complete chaos before President Biden came in. Now what we see is an order and some deliberation, and we can all breathe a sigh of relief. So this partnership is the perfect example of that. And thank goodness we have, as Mayor Schaaf pointed out, a Governor Newsom, who hustled and made sure that President Biden paid attention to California and that we have this partnership and that we get to open up these sites here in Oakland and in Los Angeles in communities that were particularly impacted so we can get as many shots in the arm as possible as quickly. Now, we know this virus, COVID-19, has been having the upper hand. And we got to get it down from not having the upper hand. And if we don't get vaccinations in the arms as quick as possible, COVID's going to continue to what they call a virus mutates. And when it mutates, it changes form and it can do other things, and it could potentially cause us to lose a lot of the great gains we've made. So we need incredible partnerships like this, where we can still have the delivery of vaccines that we have. If you're a Sutter member, a Kaiser member, whatever, you know, the other ways that are currently now delivering vaccine, that in addition to that, we can have this new influx of vaccines from the federal government at these mass sites like the Oakland Coliseum in impacted neighborhoods. So thank you, Governor Newsom. Thank you, President Biden. And thank you, A's and City of Oakland and all the other partners that are going to make this happen. Get vaccines in the arm quickly. Thank you.
As president of the Alameda County Board of Supervisors, along with my colleague Nate Miley and also our healthcare agency director, Colleen Chawla, I want to say, first of all, thank you to President Biden. Thank you to Vice President, our own Kamala Harris. Thank you to FEMA. Thank you to the Biden administration for this opportunity. I also want to say a big thank you to our governor, Gavin Newsom. Our counties and I have had an opportunity to work with Gavin Newsom since he's been governor. He has always been present around the flooding that has been taking place and keeping local government in the loop and involved in that, around the fires that we've had. And since this pandemic has hit this country, since last March, Governor Newsom, his administration, the healthcare agency director, Director Ghali, and others have been on calls almost every single week regarding this pandemic. I know that at least I've been on 3 calls every single week in which the administration, Secretary Ghali, has been gathering the 58 counties to say, how do we get rid of this pandemic? And for that, I want to say thank you for your direct involvement and your administration involvement. The word that I heard today was partnership. Federal, state, and local government coming together in a partnership. And that's what it's going to take in order to beat this pandemic, in order to deal with this virus. Alameda County is the best place to kick this off because we reflect the rest of the United States, we reflect California. We have urban communities, we have suburban communities, we have rural communities, we have old individuals, we have young individuals, we have physically challenged individuals all living here. We are a diverse community with multicultures and multi-languages all here. And the ability to partner in order to deal with this virus that is killing people across this country, around the world, a virus that is almost going to be equivalent to that of the Spanish flu of 1918 that killed almost 50 million people by history around this world. And unless we have this kind of a partnership, which have come together through the Biden administration, through our leadership here at the state from Gavin Newsom, and from local government coming together, it's going to take this kind of partnership to go out into the community and make sure that the least amongst us, those who are living on the street, those who are unsheltered, to those who are living in million-dollar mansions, have the ability to make sure that they equally can come together and get this shot so that we can beat this virus. So again, thank you very much for your leadership. Thank you again for the Biden administration for the partnership, and the local community is going to come together to make sure that every single one of us is vaccinated. Thank you very much.